People who want to become doctors usually are caring people. That's one of the reasons why they want to get into the medical profession.
Indeed.
But with time, it's been shown that many of them become less sympathetic. And so there was a study done to talk about this. So we're going to be talking about what happens to these doctors that they become desensitized to the patient's plights, and how they do this in just a 3-hour program.
Well, they get much better in a 3-hour program that they did. It's good that what they're really doing is resuscitating the doctor's feelings for people. Because what happens is we tend to look at a lot of the things in medicine as scientific. And that usually means being detached, not connected to the patient, talking about the gallbladder in room 235 or the heart attack in room 222, and not really knowing anything about them or their families or their situations or how they feel, even though superficially we do some things to investigate that. So it's important that doctors not get that way, because after you've been out in practice for a while, you can see that the harsh training and the harsh scientific approach that's taking is so depersonalized that it gets away from looking at the healing aspects of what's important when someone has an illness.
And you know, doctors need to realize that they are role models for the resident physicians.
For sure.
And the medical students. And so they need to show their feelings so that it's like okay for the ones that are learning. Another thing that I think happens is that many times they do painful procedure after painful procedure, and so they get a little detached so that they protect themselves from getting emotional about it.
Yeah, well, you do become desensitized. It's easy to get that way because you know it hurts when you're doing something like a bone marrow biopsy or some other invasive procedure, and it just hurts, and you try to get people to calm down and relax because you want to get your job done. But the problem is that when we're taught how to do these things, the people that tend to be the teachers are the ones that are the most scientific and the least engaged with the personal side of a person's story. And it's the personal relationship very often that does the healing. It may not do the curing, okay? We may do the curing, which means fixing the symptoms with our medicines and our technologies, but the actual healing where people learn about the meaning of the illness in the context of their whole life story and how that fits into their whole social environment is a huge factor that gets overlooked.
Just like the story that I related in the past was that I walked into a patient's room that was having difficulty breathing, and after the respiratory therapist left, she looked at me and she said, "I don't know what it is about you, but ever since you came in here I could breathe."
Yeah.
Well, I just was in a space where I was calm and I was relaxed and I was just there to just be with her.
Yeah, touch is really important.
So, you know, this is something that people need to be aware of, or that are healthcare practitioners, rather than just giving a drug or something. Sometimes just being with somebody is enough.
Yeah, the detachment is serious. And good healers, after they've been out of practice or out of their residencies for a few years, start to get the idea that it's the relationship, it's the connection, it's the listening and the caring that makes all the difference in the world in how people do.
And I think that the first step for the residents is to acknowledge that this is something that's happening to them, or something that can happen to them, because then they can do something about it after they acknowledge it. And maybe that's why a program that's only 3 hours works.
Yeah, well, it helps because, as I said, it resuscitates their interest. It brings them back to who they were when they started. But I wouldn't be pointing at the medical students, the interns, or the residents. It's not their fault. It's the fault of the system. It's the fault of the teachers. It's the fault of how the whole program is put together. They aren't so much oriented to the touchy-feely part, which I think is the most important part of medicine. It's not about the technologies and the drugs so much, although that clearly can save lives. You need to be a balanced doctor, one who understands what's going on in both of those arenas in order to be able to bring your patient back to wholeness again.
Well, the other thing is, too, is that if they're in a hurry,
which they typically are,
or they're under a lot of stress, or they're tired. Think about how you are when you're with your family, when you're tired or stressed or don't want to be interrupted because you have so much to do.
Well, again, that's not the fault of the medical student, intern, or resident, or the fellow.
Yes,
That's the
system.
fault of the system. And it's because it's so economically geared. When you think of how much more money it would cost to provide services in our teaching hospitals if they used other doctors or even use physician's assistants or nurse practitioners, it would be close to $500,000 to $1.5 million per student or resident in that setting. And if you got 150 people in that program, you could see how that gets to be big money quick. So
They become cheap labor.
well, yes, they do, and money does the talking. So when we look at this insensitivity that we blame on doctors, it's not them that's insensitive. It's something it's imposed on them because of the way the system is. So I have a lot of compassion for people who are in training, and I'm really disappointed with my colleagues who have not come to the rescue of these people who are going through their training programs. They shouldn't be working long hours. They should have time for their own lives so they can have some balance in it. They should have time to raise their families. They should have time to be able to work with their patients on a very personal level. And maybe admitting 10 patients a day is not the smartest thing in the world when you're on a particular service. It'd be more maybe valuable to admit 2 patients a day or 3 patients a day at the most, and spend a lot of time trying to understand what's going on with this patient at the deepest level.